There's a cost to caring, especially when you're constantly faced with the rawest parts of humanity. But for some, that cost is also what gives their work meaning.
I pretend that I completely switch off, but I don't. Even though I'm dealing with the most traumatic things often, especially on the streets of South Brisbane, and they're really tough days, and people are revealing to me things, shocking things, which I often haven't told another soul. I leave that place energised because you know that your little interventions, you haven't fixed problems, but you've made a difference.
This is a conversation about burnout, boundaries, and the quiet power of showing up over and over again, even when no one else does.
If you want to continue to hear about real people making an impact, then hit follow or subscribe. It's the best way to support the show and make sure that you never miss an episode.
We care for the lightning sea. We care.
Today we're super excited to have Dr. Jorgen Landmann with us. He's a local GP who is proof that choosing a career in general practice can really open up some wonderful opportunities. Jorgen currently holds several roles. He's a community GP, a doctor for the homeless, and also works in a correctional facility. And in COVID, he even set up a home clinic to give jabs to frontline healthcare workers. Fun fact, or maybe an interesting fact, is that Jorgen has treated both Kate and my families at various times over the last few years. We've got loads to talk about, but none of that is going to be our medical history. We're just going to keep it. We're going to talk about you. So welcome today, Jorgen, to It Takes Hub.
Oh, thanks very much, guys.
Thanks for joining us.
Welcome.
Thanks.
So this is a big role flip for us because usually
Yeah.
we would be sitting in a clinic with a whole bunch of kids
Looking
on our
very
lap,
different, to be fair.
not looking like this. I'm the parent that keeps all of the healthcare things for the weekend and then go and
Yes.
find an appointment. So
Yes.
by then it's a bit too far gone usually. But anyway, I've always said that whenever we go and see you, you're always talking about all of the different roles that you hold. And you always kind of drop in a bit about working at Emmanuel City Mission or at the prisons or out at the university. But we've never actually been able to talk about all of these opportunities. So, and today came with Kate and I talking about the CEO Sleep Out that I'll be doing this year. So before we get into all of that, tell us about you. Like, where did you grow up and did you always want to be a GP?
Yeah, look, I suppose the concept of being a doctor and being a GP was always there, but I never really thought too much about it. I grew up in Warwick, which is a rural area. Yeah, no, my dad was a school teacher, so we went out to Warwick and I did my primary schooling there before moving back. So always had a bit of an interest in the rural settings. And then came back to Brisbane. I always wanted to do medicine, but I enjoyed high school a little bit too much. So ended up, got into university, went more down the life science route and did all sorts of things and effectively had a gap decade. And enjoyed every part of it and don't regret any of it. And but then sort of went into, always was sort of attracted to that sort of working with people and medicine. So general practice is the logical profession for me. What I love about general practice is just the absolute flexibility to do what you want, where you want. And I still remember one of my mentors telling me, he said, Jorgen, you know what you need to do to specialise in general practice? And I said, what's that? He says, you need a good sign writer. And he says, call yourself whatever you like, do whatever you want. And, what other profession does that? And, it's just, so that's where I grew up. And
as your general practice, so once you qualified, did you just stay initially in clinics?
Yeah, so once I qualified, so I did my medical degree, I did my residency years down in Logan, and I was actually lucky. There was a general practice in I just started the GP training, and there was a practice in Inala working with a lot of refugee health and a lot of the very poor there. And I learned so much in that year and just passionate doctors and just the value of a good mentor. So I did that, then I went and worked over in, I finished my residency years down in Rochdale and my registrar years as a GP registrar. And then I started working in Carindale,
That must be where I met you.
Yeah. And look, and whilst it's whilst I've always had a passion for doing something, and sort of helping other people, the vulnerable communities, ultimately mortgages come along as well. So, so I was working busy in private billing land. Do I insult you guys by saying looking after the white wealthy in Warwick?
You kind of have, so just go. Just own it.
But yeah, so look, I was doing that, and along came COVID, which was, we didn't know what to expect. It was busy, and we thought thought we were going to sort of close down, but
Yeah.
medicine ended up being busier than ever.
Yeah.
And so I was working 14-hour days, starting at 5 in the morning, doing a couple of hours of vaccines before consulting at 8. And I just burnt out, and I just thought, no, this is... And I remember ringing my boss, and he was really good, and I just said, look, mate, I just can't do this.
Yeah,
And he
that's a
says,
lot.
look, you enjoy your weekends, and I've always enjoyed working my weekends, and he says, why don't you just do your weekends? You can have whatever you want, and just take a break, think what you want to do. So
That's
I was,
fantastic.
I was really lucky to have a boss which sort of
Supported.
Yeah, exactly.
Yeah.
And so so that's when I sort of was taking a break, and then because I had done a vaccine clinic, which I
Let's ask about first before we get onto that. The clinic in your house, in your backyard. That sounds really bad. A backyard clinic.
yeah.
How did that come about?
Is that
and-
easy to do?
Well,
Can you just do
Can
that?
you do it? Is
you
it?
did it.
Yeah.
Yeah, so look, I suppose what I've always been interested in is everyone always tells you why you can't do something.
Yes.
And so
Yeah, they
sometimes...
do.
It's familiar,
I'm
right?
interested in
Yeah,
that too.
yeah.
Go on.
So I always throw it back to them and say, well, why can't I do it? Why can't we just do this? And so what happened, it was the beginning of COVID, and everyone was scared. Nobody knew what was going to happen. A lot of doctors were there working long hours, and then they wanted to protect their own children. So, and they were sort of saying, how do we get the flu vaccines out? Because, even though it was
winter
COVID,
coming
you
up.
think, well, if you've got COVID and flu, what's that going to do?
And if you think back to 2020, like people were actually staying away from their families, weren't they? If you're in the medical profession, I remember hearing stories of, doctors who didn't go home and stayed somewhere else just to protect their own family. Yeah.
I know, in hindsight, we think, what were we thinking?
I know.
Yeah, like it
we
feels
were
hard to
also
remember that
scared,
now, doesn't
like
it?
you don't know what's
Yeah.
going to happen. So what I thought was, well, I've been doing flu vaccine clinics in schools for ages, so I thought, well, I'll just buy a whole heap of vaccines in and just do it from the backyard. So I put it out on this group. It's actually Brisbane Medical Mums. I'm the token father there. And I know there's about 1,000 doctor parents there. And so I just sort of said, look, I'm just doing this in my backyard. If you want to come and get one, I'll just do that, just bulk bill a consult, pay for the vaccine out of that. And there was a donation box we were collecting for a charity over in the Philippines, so basically they all came and it was a huge success. Didn't think it would be successful. I think we did around about over 3 days. I did about 1,000 vaccines.
Yeah, wow.
And so I was just in the backyard and
You
it
just
worked
did
nicely.
that for 3 days.
Yeah, it was
Yeah,
3 different days,
yeah.
and I still do those vaccine clinics. Like it's always my, the medical mums. It's
Yeah.
usually Anzac Day afternoon, and
Yep.
it's a social thing now. It's they can go anywhere, but it's also good for the kids. They sometimes go. They're not sort of. It's not sitting in line in a doctor's surgery or a pharmacy to get it.
Feeling
and
nervous and all of those things that
exactly.
come with it.
So they just go. There's usually get a vaccine, go have a lollipop, chat with all the friends.
Yeah.
So it's
That's
a
the
model
other
which
annual.
started and it just worked. So that's what we
Fantastic.
continued. So
So now, let's talk about Emmanuel City Mission, because this year I'm doing the CEO Sleep Out, and I know it's a token in some ways. We're sleeping out for one night, but we talk a lot here about how we can create great healthcare outcomes. For these communities we're supporting at Cornerstone, but how can you even prioritise health when you're homeless? And we talked a lot about, well, could we have someone that we could speak to today about what actually is the impact of, I guess, the healthcare options available for someone who's homeless. What's the work that you do at Emmanuel City Mission? What do they do?
Yeah. So Emmanuel City Mission is Brisbane's biggest homeless drop-in centre. Basically, it started out with another guy, just a guy who said, oh, look, they're a church. I'm not part of their church, but they just sort of said, look, rather than us being, here on a Sunday and closed up for the rest of the time and there's people on the streets, why don't we just open our doors and welcome them in? And it started a number of years ago with a barbecue, and they just used to do a few sausages, and then it just grew and grew, and it works outside of any government funding because they like, well, not that they would say no to money, but they're conscious that they can do what they want and support their people without any strings attached. So there's. They basically, it's an open living room. people walk in there. They open from, I think, 7 till 3. You walk in, you can have a coffee, proper barista coffee. There's a wonderful roastery in Maruka which donates the beans.
Yeah.
And they have a coffee. There's a hot lunch served at 12 o'clock. But more to the point, it's just somewhere they can get off the streets, and it's sanctuary for them. They maintain a very high level of behaviour. There's no bad language. There's no, they can't come in intoxicated or anything else.
Just a safe place for them to be.
It's a safe place, and the visitors respect those rules. And if there's ever a bit of an altercation or someone, there's no security or anything, but if there's everyone getting a bit sort of riley, the other visitors escort them out, because what happens if is they'll actually just close the centre if it's a problem, and then you've inconvenienced 150 streeties. And
I was just going to say, how many people
what's
would
the
go
volume?
through there every day?
Well, it's up to about 200 hot lunches a day they're serving.
7 days a week?
So weekends they've got shorter hours, but 7 days a week. I think it's a barbecue on Sundays. I'm always working in private land on those days, so I don't know what happens on weekends.
And that's just volunteers coming to serve those lunches? And
so look, they have a few paid staff, but it's for very few paid staff. But volunteer coordinating the volunteers, and a lot of school groups come through, which I think is really powerful, because they have I think there are about 20 schools associated. So rather than just collecting money for Emmanuel City, for a charity and saying, oh, this is helping the homeless, or what they always say is, look, they say, come along and have a look. And have the kids there. The kids actually serve lunch, cook the breakfasts, so they'll cook some bacon and egg rolls or cook the lunch, and then actually go and sit amongst the visitors to sort of break down stigmas, break down barriers, and then teach. This is the new generation, This is social justice awareness, which you're actually seeing, not just hearing about and donating to put into a bucket of money.
And this is what we're trying to do with the team here, isn't it? It's about you having your night of sleeping out, but we're thinking about all the initiatives we can do in here as a team to raise awareness and actually get them out into the community to experience that for themselves. Absolutely.
No, that'd be great.
And so I guess from a medical perspective, so is there also a clinic attached to this, or do you just see what's your role?
So look, basically what happened, it was actually a bit of serendipity on how I got there. So initially, because I'd done the flu vaccine clinic, one of the med students actually who I knew said, there's this initiative where we're doing COVID vaccines in this drop-in centre at the Red Cross Night Cafe, which is under City Hall there. So that's for 12 to 25-year-old homeless and 12-year-old homeless, which we have in Brisbane. But they said, look, would you like to do a COVID vaccine clinic there? And I said, look, mate, nobody's going to want it, because this is towards the tail end of it. But I thought, no, I like promoting, supporting the medical students, because they've got to see a failure to learn what works and what doesn't work. And sure enough, as predicted, it was a failure. I think I did one vaccine, and that was to one of the other volunteers. But whilst I was there, I was talking to a street outreach nurse, and I was talking to her, and I had plenty of time to chat, and I like to chat. So, and she was saying,
don't at all.
Yes, and she was saying, look, we see the same people, the young people, they're stigmatised when they go to emergency departments. They're the junkies, they're whatever. So we do their dressings, and then they come and go, and we just do the same dressing day in, day out. A lot of it is sort of self-inflicted or from fights or whatever. But it's infected, they need to see a doctor, and I sort of, famous last words, I said, look, I don't really want to get involved, but if it's really that, look, just send me a text, I'll flick you a script for an antibiotic, and, if that's going to help you out. Then I sort of got a little bit more interested, and I thought, they did a few clinics around the town, and I thought, I'd like to actually go and have a look at what they're doing. So somebody told me, look, they're doing a clinic in the valley. They gave me the address. You turn up to there of an evening and have a look. So with young kids, as we all know, we don't often get hall passes. I got a hall pass.
Waiting for that day. Go on.
So this is how exciting my life is.
Yeah,
I got to go out and hang
when
out.
you talk about your hall pass and mine, I feel like they're different. But anyway, let's go with yours.
So I got to go out into the valley of a night time to check out a homeless drop-in centre. So anyway, it was a Wednesday night, and I thought, well, I knew my son's school was associated with this place called Emmanuel City Mission. So I said, I'll go and pop in there and have a look what's happening. So, because I'm not going to go home. I'm allowed out.
Yeah, you've got the whole pass.
Exactly. Somebody else is
Good on you
putting
for
the
not
kids
going
to
into
sleep.
the valley.
Very good, yeah.
Exactly. So I found them there in South Brisbane and had a look around, and I talked to the boss there, the guy running it, and I said, look, would there be use for having a doctor come in here? So, and they said, oh, look, you can have we could try it. You could set up a clinic here if you wanted. We'll give you a 4-week trial and see how you go. So I started doing, just setting up. I literally set up at a fold-out table at the back of the hall, operate out of a backpack, have a laptop, and just do general practice services. Well, it got flat out, always busy, and just people coming in for a bit of a chat, but just offering full GP
Word got around that you were there.
So I started doing that regularly on a Friday. They've never reviewed my 4-week trial.
How long ago was that?
Oh, a couple of years.
Wow.
And then they actually, ironically, the homeless drop-in centre became homeless because their lease wasn't renewed. But they luckily moved up to this wonderful new facility, which was the old men's hostel, which is in South Brisbane, which had been sitting vacant for a couple of years. So they took it over. Beautiful facilities. I've actually got a doctor's room there now because they used to run a detox out of there, actually with Dr. Sturman, who I still work with, she's down in New Farm now. And so there's a doctor's room, there's a treatment room. They actually had a four-bed procedure room there from the detox, but we're not using that. But even though I've got my doctor's room and it's set up there so I can do procedures, which I I used to do procedures in the last place, but doing them on a church pew was a bit interesting.
Yeah,
cutting out skin lesions.
You've really got to be
Amen.
right.
But it's, again, you always ask the question. They say, oh, can you do that? I say, well, why not?
Yeah.
Sure, it's not the most private or whatever, but, it's not like these guys haven't seen a knife or blood before.
No, true.
And
do you feel that you can have real impact in that role?
Oh,
like there's got to be
absolutely.
some.
It's
Have you
so
got a
fast.
story that you can share of just the impact that you've had on one person?
Or there is a particular person that's stuck with you of, you know.
Look, there's it's so nice, and it's all chipping away. Very rarely do you have someone come in and you give them some advice and have changed their life. But it's what I love about working out of Emmanuel City Mission is people have got their guard down. They trust the organisation, they trust the volunteers there. So when they come and they see a service which is there, they sort of trust you a lot.
Yeah.
Now sometimes they'll come and health, as you mentioned earlier, just isn't on their radar. Probably 20% of the guys there have got hepatitis C, and it's just the contrast to, they've got hep C, they know it. It can be easily treatable with, 2 or 3 months of tablets, one a day, and they're just not worried about it. Put that into contrast where I work in private land, where somebody's liver function test is slightly out. I need to see the best hepatologist in Brisbane. Who are they?
Completely.
And so basically, you see the guy, they're really pre-contemplative. They just, look, whatever, I don't care. And sometimes they'll even think that that they're baiting me, as if I'm really worried the fact that they're not being treated. But then you just get a rapport and you see them over their cut or a Centrelink certificate. And eventually, you start engaging them until they actually say, and, look, Doc, how you've got that hep C? I think I'm ready to get it treated now. And it's like... those are the moments which really get you going. Or when somebody comes back, they've been on the streets, had a completely chaotic life, they're addicted to all sorts of substances, which is what's essentially kept them on the street. You keep challenge the behaviours. When you see them, and this is, I said I've got a doctor's surgery, I still operate out of a table at the back of the hall because that way I can keep an eye on everyone. I'll go up and I'll have a chat to them whilst they're having lunch. And eventually, when they see that somebody cares, then they actually, because some of these guys have never had someone care for them ever in their life. Who knows who Dad was? Mum was probably on the gear. Their life has been very transactional. They're in and out of prison, and then they suddenly come to you and they say, "Look, it's not fun anymore." It's like no, but they don't know how to get out of this. So you show them a pathway. To us, it's so obvious what you've got to do, but just even the concept of how do you go to apply for a job? What would you do? How would you put a CV together? Just all these type of things. And so you do that, and then you come back and they're in high vis because they've got a job as a labourer.
That must feel really good
oh,
when
it
you
is.
see
Look,
them
I'm
walking.
tearing
I
up
was just
just
going to
thinking
say,
about
you
some
get
of them.
so emotional when you
It's
speak
just-
about this work.
It is. It's just, that's when you know you've won.
And when you're really getting through to them and helping them to see what could be, is medication and thing available? Like, is that, can they even access it
Well, look, so...
in terms of cost?
No, well, so this is a problem for them. You know, you can write a script, and often they'll go up to the emergency department with an infected whatever, and they'll get a script for the antibiotics. But if you've got no money, what do you do? So, look, in the end, I started. You know, often I just sort of said, look, you know, it's $7.70. You got a healthcare card. I'll just pay for it. Look, I was bulk billing it. You know, I was making something, but you know, you're not there for the money for sure. But yeah, I was usually paying for it out of my own pocket. Occasionally, we've had different organisations. I've had a couple of little grants of $1,000 to set up a pharmacy account at the local pharmacy. So yeah, but price of medications is a major barrier. So it's not, or even dressings. You know, they've got these big infected wounds, and they're just open. You go, mate, why aren't you having a dressing on that? It's like, oh well, yeah, that's money. So.
They sound so lucky to have you in that setting, and you clearly just care so much. You talked there about people going sort of in and out of prison perhaps, and you also work in one of the correctional facilities. Can you tell us a little bit about that role?
Yeah, so look, what struck me is people, you know, it's one thing I can see the guys, I can sort of help them, and then you're getting somewhere and they're off in the prison system again. And it's just in and out of prisons because, in my opinion... Oh, it is. I don't think we really support people, you know, transitioning back out. You know, it's... Yeah, if you've done, let's say, a few years in a correctional facility and you've got less than $100 in your prison account, then when you're released, what you're given is you're given it's called a blue bag. It's got a $20 Go card in it, a $30 Woolies voucher, two $25 Vinnie's vouchers, a towel and a few toiletries. You're dropped at the train station at Wacol and said, good luck, don't reoffend. Now, if you... exactly. And look, you can go to Centrelink, you can get an emergency crisis payment plus a forward on your next check. So you'll have $600 to your name and you're left in Brisbane. And you probably weren't often... To be honest, probably not the most functional member of society going into prison. And now I can imagine dropping me into a foreign city or a city.
But then if you've had nothing
else.
And you get given $600 as well, if you can get that advance.
Well, that's it.
I can imagine how to wisely use that and set yourself up for success probably isn't at the top of the
Absolutely
list.
Not. So what do they do? Look, and a lot of guys, some guys when they get out of prison are always going to go back to what they were doing, but I just see them time and time again at Emmanuel City and like, Doc, I just don't want to be here. I didn't enjoy my time in prison. I really don't want to reoffend, but what do you do? And a lot of them were picking up these big drug addictions because there's a medication called Suboxone they all get addicted to, and they rack up big debts in the prison as well. So they leave with an addiction and they leave with a big drug debt. So now again, not only are you left at your train station with your blue bag and good luck and you've got $600, but you've also got $100,000 drug debt to a bikie gang. How do you service that debt? And round we go. So this is where I rang the head of prison health and I said, look, you know, what are you guys doing? And he says, oh, it's not that easy. And it wasn't that easy. So I thought, well, why don't I go in and, you know, there's one way to fix a problem. And I had an idea on how to do it. And look, don't get me wrong, the prison health doctors, nurses are fantastic and they're very passionate. But, you know, under-resourced, understaffed. And so I thought, well, I'll go in and do some work in the prison. So I basically work just in opiate substitution there. And we see big... You know, so I started at Walston Prison because my actual next-door neighbour was an officer there and he said, I was mowing his lawn and he said, I'll come and work in prisons with me. So I started working in his prison and he used to introduce me to all his mates as the guy who mows the lawn is now fixing our opiate problem.
I was just about to say, so you're volunteering around town and you're also mowing your neighbour's lawn. I feel
I
really
do have to confess, I do have my guilty midlife crisis purchase, which is a ride-on mower.
Oh, well, there you
And
go.
if you've ever had a ride-on
I was going
mower,
to move to LA.
better
but you
than
got
a
to
convertible.
no. Do I have a lawn big enough to justify a ride-on mower? No. But
405 block.
so if I can find my neighbour's lawns and they'll let me mow it,
Right.
it's a
In your
serious
local
one. It's a
area.
John Deere. It's even got a stubby holder. So
Yeah.
so
How different
but-
your midlife crisis is.
yes. So anyway, so off we so there I am, and it was good. We fantastic support from the nurses there and the prison system, and we got rid of the the wait list to get on the opiate substitution program, and
And what was
it
that? What was the wait list?
it was probably about 12 months to get on. So, there's a lot of damage you can do yourself in 12 months using sort of black market, Suboxone inside the prisons. And, to give you an idea, these guys were spending hundreds of dollars a day on their habit, which is not only an impact for them racking up a debt when they get out, but it's also for their families. And we know, as I'm assuming you're law-abiding, I think I am. And but if you had a child who rings you up and says, "Look, Mum, if you don't transfer $30,000 to this guy's account, I'm going to get beaten and raped," what would you do?
Yeah.
You just do it.
Yeah.
And so they're bleeding their families dry. So anyway, we fixed that problem, and
Was the program already there when you joined?
It was
And
there.
what was your role? What do you do in the program?
So I
as a doctor?
basically just see the patients, put them on the program, and also just adjust them. But it's not just giving them the drugs, it's actually trying to address some of their issues. I've had a number of the guys come and see me in Emmanuel afterwards, and I said, "Look, that's where I am, if you want," and just that support. But again, it's just that supporting the guys, not just, you're not a number
Beyond
to them.
that clinic room.
Exactly.
Yeah.
And even when they come in, the officers will often say, "We'll call up prisoner such and such." And I said, "Oh, no. They're my patient. They're not prisoner such and such. They're Bob, they're Rachel, they're whoever." So it's just that support. And also then talking about, all these guys, they could be the fully, the big bikey enforcers, full face tats. Mate, you get them one-on-one, they're just scared. A lot of them are just scared. They don't know where to go. So it's just supporting them, getting them on an appropriate opiate replacement therapy, telling them how to continue that when they get out. And what it's done is it's cut down dramatically the illegal drug trade there. There's always going to be some. I was talking to the prison officers themselves. They love it. The general manager of the prison, they said, look, they're saving millions of dollars in overtime because there was, whenever someone was illegally injecting, and bearing in mind you can't get needles inside the prisons, so they're using homemade needles which have usually been passed around 20 different guys, and the infections, and so that was just, he said,
the knock-on effect to health,
yes,
other
absolutely.
issues.
And all the ambulance taking people to PA hospital, and I can say I've talked to the doctors there, it was costing the PA hospital millions of dollars a year in injection-related injuries from the prisons. It's not to mention tying up all these ambulance crews.
All the resources.
All these, and then the corrections officer, every guy going to hospital takes 2 officers, 2 corrections officers to stay with them. And so it was just, now that everyone's on the program, there's hardly any medical escorts out. Everyone's more chilled. Because otherwise, if you're addicted to a medication and you need that when you wake up, you will do anything to get it. So mental health referrals are down by 3/4 in the centre. There's less standovers, less fighting, less. It's just been shown how one medical intervention, and it's not rocket science, I didn't do anything special there, but just being able to provide that service can have so many knock-on effects, and so that's what I love about medicine. I'm a GP,
That's one
I'm not
person.
an addiction, I'm not an addiction
Say, yeah.
specialist. I'm not one person. There is a team behind me. There is a team of nurses, very passionate nurses, and it's everyone through to the administration staff. But it's just how, in medicine, this is what I love about general practice. I can go from private clinic to deciding I'm going to set up at a table at the back of a hall with my laptop, through to I can go into a prison and do opiate replacement.
So
and
that's your sign writing reference in the beginning when
exactly.
you're saying as a doctor you need a good sign writer because you can create an opportunity go down the passion projects that you have.
Exactly, and you've got that, and also I never get bored, because I find a lot of doctors burn out because they're just doing the same grind and the same thing all the time. So look, I've got a very short attention span.
Has it helped? Because you referenced earlier the burnout you felt after COVID. Has having some of these different projects?
Oh, absolutely.
But these must still burden you, right? Like, is it in a different way? That's still, you're taking on a lot of people's things, which must...
You do, but look, I always remember when I was in the hospitals and I was doing a bit of palliative care, and I was talking to the consultant once, and I said, look, how do you not get affected by this? You're dealing with people who are dying all the time. And he says, look, the day you don't get affected, go home, you don't belong here. But, you look at the benefits, you can't, and I think every single person in the medical field knows that they can't fix everybody else's problems. You can do your best, and I pretend that I completely switch off, but I don't. But I actually get, even though I'm dealing with the most traumatic things often, especially on the streets of South Brisbane, and they're really tough days, and people are revealing to me things, shocking things, which I often haven't told another soul. I leave that place energised, because you know that your little interventions, you haven't fixed problems, but you've made a difference. You get that feeling that you've made a difference. And I actually, whether it's there or working at Carino, even though I've cut back my hours in private GP land, I love it, because I've always myself to my patients. If they want a tie-wearing doctor, they never come back to me. Actually, I'm wearing a shirt today to this interview.
Particularly
I can tell you,
today.
this is the only shirt I wear, because I don't own shirts.
But you think about, do you remember when we were speaking to Dr. Dinesh last season, and his mum always said that you can't change the world, but you can change the world for that person. Yeah. And you can really have that impact directly on that person today for that moment.
Yeah. I love that saying.
Yeah.
But it's true. You can do your best, and you get excited about being able to go in and do that. And I get excited every day. There isn't a day when I don't go to work and I don't look forward to going to work.
Have you ever felt
how lucky
fearful? Is there ever, if you think about working in prisons, working with the homeless...
No.
There's so many stigmas that are attached to these vulnerable groups, and I guess what are the assumptions that people make that are wrong, and have you ever felt unsafe?
Yeah, look, I don't feel unsafe, and look, would I let any of my patients babysit the kids? No. But yeah, look, it's essentially, I think we're very privileged in healthcare in the fact that people respect us and they trust us generally. And if they don't, it actually gives us an opportunity to explore the why. And a lot of these guys have been treated very badly by the healthcare system. They've been stigmatised. You walk into an emergency department and you've got face full of tats and track marks up your arms, A lot of them have been treated, very poorly, even if they're coming in asking for help for a mental health issue. But I think I'm always very clear with my boundaries, and I'm very, you don't let your guard down. But on the same note, I don't think anyone's ever had a problem. I don't really feel scared. Prisons are the safest place of all, because I'm dealing with the same guys on the streets, except the difference is that even though I'm in a consult room, I've got a duress button, and one press of a duress button, I've got the whole turtle squad there. Yes.
Has the there's this real theme in your work around supporting vulnerable groups, and has this emerged over the years? Post-COVID, or was there an experience in your life, or is it where has this come from?
Yeah, look, I don't know. I suppose I was lucky again with my upbringing. My parents were always, I think we learn a lot from our parents, and even though they were both first-generation migrants, if there was ever anyone it was Christmas time, there was someone in the area who didn't have somewhere to go. They were at our table. So I suppose that's where I learned a bit from, But I think you learn a lot about yourself by giving, and look, and I enjoy it. It's.
And I guess, what do you do to unwind and to make sure that you look after yourself whilst you're looking after all of
Other than
these other
hooning
people.
around on a John Deere with a
Is
beer.
it the lawnmower? Is that the relaxing moment for you? You know, what are the things that help you to make sure you can be at your best for others?
Yeah, look, it is the lawnmower.
Yeah.
No, but it's that changing. It's
I'll
not
let you know where you
getting-
I actually need a gardener. Not
Yeah, so no, it is. I suppose that variety is always something which, I'm not getting bogged down in the one
Yeah.
thing. Also, the beauty of general practice is set your hours. So I actually do my wife does 3 of the drop-offs. I do pretty much. Actually, I do all the pickups from school. So I finish at 2:30. That's it. We're just so privileged in this career that you can just determine your hours and find it. You can't do that in every role, but you just don't take those roles. And so I get to spend time with the kids.
And they're your boundaries, right? This is what's important to you.
It is.
Yeah.
I get to pick the kids up, spend time with the kids. Look, it's actually more stressful.
I do pick up every day. I was like, that's not my downtime.
Yeah, exactly.
I need the boundaries there.
But that's it. So this is where you do that, and I have every second Saturday off, which I like. I've got a couple of days off during the week, so I can come and see the lovely people at CMR on a Wednesday. So so this is my downtime. But as I said, I actually get like my hobby, medicine is my hobby.
Yeah.
And I always love that saying, if you love what you do, you never work a day in your life. So people say, how do you unwind? It's like, I've just done 2 14-hour days in the prisons, just getting on top of some stuff. And I have just been so looking forward to that for a long time because I didn't have to do pick up on those 2 days.
Yeah.
But it's also like, my mind is I see a project I want to work on and I get excited, and it's the same way other guys might get excited by building a garden bed or restoring a motorcycle. Well, look, I've fixed the opiate substitution in a prison. That's what excited. Hey, I got paid for it too. Wow.
Yeah.
What's the next project then? Like,
Where to?
where you've kind of come to this, or each of these projects that you've found, are there other things that are in the back of your mind or other interests?
Yeah, I'm interested in the prison release space.
Yeah.
And as I said, I've already mentioned how we fail people, but also just that whole patient journey. So at the moment, I'm seeing them on the streets. I'm seeing them in the prisons. I want to see them through the watch houses. So how, when they get there, that we can better manage them to get them into the prisons, and then when they leave the prison, let's give them a pathway where they don't have to, where they don't have to see me on the streets of South Brisbane. So that's my next passion project. But
I think that'll keep you going for a while.
I think that will.
Yeah.
Just don't give up the Sundays at Karina because
Yeah.
I really need
She
you
still
there.
needs you. Still needs you. So CMR are making a donation to a charity of your choice with every episode. So what's your charity
I think it would
today?
have to be Emmanuel.
Emmanuel,
City Mission, yeah.
fantastic.
Yeah.
Hopefully
Thank
we'll
you
be able
for
to get the
that.
team down there as well and come
Help
and,
out. Yeah.
Yeah, help out.
Thank
That'd be
you.
wonderful.
Thank you so much, Jorgen. Just you get so emotional, like talking about, like you can see, like you're just so invested in all of the areas that you work in, and how lucky are all these people to have someone like you that they can see, and just how much you put into all of your work is just so inspiring. So thank you for finding the time to sit with us today, and it's been so nice to actually talk to you without a whole bunch of kids.
Yes. No, and look, and thank you for the opportunity. I said I'm obviously passionate, and I love that other people can sort of share some of that passion and maybe get themselves thinking. It might not be in homelessness, they might be interested in refugee health, whatever, but just always asking that question on, rather than saying, well, that's not the way things are done. When anyone ever puts that to you, just ask them, well, why not?
Yeah.
So,
Love
yeah.
it. Spot on. Why not?
Yes.
Thank you.
Thank you so
No
much.
worries.
We care for the land and sea.
We acknowledge the traditional custodians of the land of which we meet, who for centuries have shared ancient methods of healing and cared for their communities. We pay our respects to elders past and present.